why surgeons love the patients I refer. Well, surgeon love, interesting thing, coming from a chiropractor, but what we're talking about here is that any doctor should have a plan and utilize that plan for a patient. We call ours a stair-step plan based off musculoskeletal or physical medicine injuries because they're the common type we see on a regular basis. So, what I'm talking about is taking the patient's condition and making a plan for them so they have a logical stair-step plan for their future. So number one, let's say you get a low back injury. You come in, the first thing we do is conservative care. We're going to talk about exercise, yoga, ice, heat, stretching, rest, proper nutrition. We will even talk about water usage and all the basic things of which many you can do at home. We'll couple that with some spinal manipulation or adjustments on a very limited basis and see how you respond. Depending on the injury, you may have gotten x-rays or an MRI even before we started that. However, let's assume you did not. So this next step would be step 2. We're moving up the ladder of severity. We're going to make a specific treatment plan and design adjustments that are a little different. We might start using more therapies, which include heavy trigger point therapy type stuff, heavy stretching, assisted stretching, and ART type activity. And we'll even do some laser therapy, electrical muscle stimulation, some acupuncture, acupressure, and those kinds of things. Now, depending on how you follow that, there should be a timeline that goes along. So again, after a couple weeks, if you're not responding, we're going to start looking at more aggressive and invasive stuff. The next step would be possibly getting an MRI or additional imaging before you would consider doing some medications or injections. Now, these additional things require more examination and more detailed workup. So if you were a candidate and you had a disc, you could do spinal decompression in our office, or we might encourage you to see a medical doc and have an epidural injection. Now, even though that seems contraindicated for a chiropractor, this allows you not to go to surgery right away, and again, it's trying all the conservative and active care mechanisms. So by step 4, now the next step would be a surgical consultation. By the time you get to that surgeon, you've tried a multitude of things. You've tried looking at active care, conservative care, you've tried chiropractic, you've tried physical therapy, you've tried some stretching, you've tried muscle work. And if none of that's working, you're a good candidate for a surgeon, particularly if the symptoms continue and have gotten worse or you have the right symptomology. Therefore, that's why surgeons like us, because we're not wasting their time and we're sending a patient in that's had all the conservative care done. And frankly, that's what they like, because then they know whether or not you're a good candidate. If you have any questions or any concerns about whether your case may be either a case to move up that ladder or spinal decompression, give me a call and look me up. Spine Pro Chiropractic. Thank you.